I'm a labor and delivery nurse, and I want to fact check Chat GPT. First question I'm putting in here is, what are some pain management options for an unmedicated birth? Because this is a question I get all the time from you guys. It says breathing and relaxation, water immersion, massage, movement and positional changes. Yes, that's a huge one. Acupuncture and acupressure, counterpressure, which I've talked about before, hypnosis, so hypnobirthing, and doula support. It's important to note that every woman's experience with pain during childbirth is different, and what works for one woman may not work for another. It's essential to work with a healthcare provider to create a personalized birth plan that takes into account individual preferences, medical history, and other factors. I am mind blown. This is so good. This is amazing. Let's do another one. Let's do, is an epidural safe for labor and delivery? It says epidurals are a common method of pain relief during labor and delivery, and it's generally considered safe when administered by a trained medical professional. However, with any medical procedure, there are risks. So possible side effects and risks, drop in blood pressure. I would say this is the most common, and we are always ready for this to happen. It says headache, prolonged labor. That's false. That's not true. Epidurals can slow down the pushing phase, so the second stage of labor, by, I think statistics show it's only like 30 minutes. It's not even that long, but it has not been shown to scientifically prolong your labor. And here it says epidurals can slow down labor, which may lead to the use of additional interventions such as oxytocin. I don't actually believe that. It says numbness and weakness, but that's the point of an epidural is to have numbness. And then it says infection. Epidurals involve inserting a needle into the space around the spinal cord, which can increase risk of infection. That is true, but extremely rare because it's a sterile procedure and we clean everything perfectly. It's all sterile equipment. And then it says it's important to discuss the risks and benefits of epidurals with a healthcare provider and make sure you're making an informed decision based on individual circumstances and preferences. So for the most part, pretty good. Just that one spot where it says prolonged labor. I don't know if that advice I would trust, but everything else is very, very on point. I give it a thumbs up.